Meet Adele, just 7 weeks into her first pregnancy, 13 weeks into her third pregnancy, and 8 weeks into her fourth, she realized that she was experiencing spotting. At those points, visits to the doctor became unavoidable. It was then that she learned that as a woman, an expectant mother, she had quite an unpleasant encounter with miscarriage.
So a miscarriage refers to pregnancy loss, early pregnancy loss likely occurring prior to 20 weeks gestation. One of the common misconceptions is that an abortion is something induced versus a miscarriage is something which occurs spontaneously. The truth is both terms are often used interchangeably. However, miscarriage is more commonly used simply because of the negative connotation of the term abortion. So most of the terminologies now that you hear individuals use is in reference to what we call early pregnancy losses, right? And those usually encompass a whole range of disorders which ultimately result in what is commonly referred to as miscarriage.
So I've had 3 miscarriages. After the first, I wouldn't say that I knew back then that those were really signs of miscarriage. I actually, in ignorance, thought that these were just coincidental things happening to my body. It wasn't until the second miscarriage where I experienced the exact symptoms that I realized that my body had given me a warning sign from about a week or 2 before, and that was spotting. That was the first thing that would have happened to me, where throughout my pregnancy, very early on, I noticed that I was spotting, and it wasn't just a regular color period looking like red. It was bright, and then it got to the point where if it wasn't bright, it was almost kind of brown or burgundy. Fast forward to about a week or 2 after the spotting would have started, I remember I was getting ready to go to church. I remember it like it was yesterday. And then out of nowhere, I felt as if someone took a baseball bat, or in Jamaican country, we maybe know more of a cricket bat, and hit me in my lower back with it. And I remember I was bent over in pain for, it felt like maybe 20 minutes, but I really don't think it passed 2 minutes or thereabout, but that's just how immense the pain felt. And I remember I bent over, doubled over in pain. I may be pushing, actual birth was the only thing worse than that for me, without pain meds. And then a few minutes later, I got the urge to rush to the bathroom, much like what had happened 6 years prior with the first miscarriage. And I went to the bathroom, and before I could even prepare myself to sit, there came the flow.
The most consistent signs and symptoms of miscarriages are initially PV bleeding or spotting, meaning spotting from the vagina, or either heavy bleeding passing out clots, fleshy materials. Up to 80% of women who are going to experience a miscarriage is going to have some form of bleeding per vagina. Second is abdominal pain. This pain is usually often cramping, varying in intensity and localized to the lower abdomen. And those 2 are usually the most consistent signs and symptoms of a miscarriage.
You could see aspects of the sac and everything that was there, because it just all came out, like tissue, things that looked like tissue or whatever. And I showed it to him before we flushed. My initial reaction when I found out what was happening was to hide in embarrassment and shame in my bathroom from the one person who would want to share in this moment with me, which to me was an indication that I thought that I somehow disappointed my husband. There is a small part of your mind that says, could I have done anything differently? Did I do anything to cause this? Did I do too much walking? Did I work too hard at work? Was I too stressed? You ask yourself those questions.
There are a variety of causes. What I would say is that most first trimester miscarriages, when they do occur, they often occur without any obvious risk factors. And around 80 to 90% of the times they occur because there was some abnormality during the formation or the early processes which are involved in the formation of the fetus. There are known notable risk factors for miscarriages, age greater than 35 being one, patients who have chronic disorders or chronic medical illnesses such as diabetes, which is uncontrolled, thyroid disease, which is uncontrolled, certain autoimmune disorder, which often causes some damage to the vessels in the body and therefore causes clots to be formed. Those clots primarily affect the vessels which form or contribute to the formation of the placenta and therefore contribute to early pregnancy losses. Very rarely, miscarriages can also be caused by abnormalities in the structure or the shape of the uterus. This abnormality in the structure of the uterus can make implantation of a fertilized egg very difficult and then contribute to miscarriages.
Of course, there is no going back, but what is done next can be significantly helpful for women who are eager to have an encounter with their childbearing wishes.
Then I would have spoken to my doctor and then she would have advised what to do next. And by the third, I was an expert. From I started spotting in that pregnancy, I knew what was possibly going to happen.
The key at that point is either reassurance or prevention of subsequent miscarriages. Now the truth is, around 20 to 30% of first trimester pregnancies will end in a miscarriage. But 90% of those women who experience these first trimester losses go on to have subsequently normal pregnancies without any problems. The issues arise in those patients who have recurrent miscarriages. So the risk tends to increase as the number of miscarriages that you have increases. So for those women, it's a matter of one, confirming the diagnosis, which is usually done through blood investigations, but also instituting some management, and that is usually in the form of either aspirin or certain blood thinners like heparin.
So the truth is, a miscarriage can happen to just about any woman, but there are some preventative steps that you can take to reduce the likelihood.
One of the things which we advise, particularly in the first trimester, is treatment of any febrile illnesses. So these could include anything like viral illnesses, bacterial illnesses, and of course it may sound very basic and simple, but avoidance of things like hot tubs or saunas or jacuzzis. Now what we've seen is that these febrile illnesses, which of course are associated with elevation in the body temperature, just as going in a sauna or a jacuzzi, can potentially trigger a miscarriage. However, for those individuals who have these underlying medical illnesses, for example, diabetes, the key is control of the blood sugars, ideally preconceptionally, so even prior to pregnancy. One, to reduce the risk of miscarriages, but also what we know is that uncontrolled diabetes in the early parts of the pregnancy can also contribute to chromosomal abnormalities or congenital structural abnormalities in the fetus, which can then precipitate a miscarriage. For those individuals with thyroid disease, we encourage that they see the endocrinologist and control their thyroid function prior to pregnancy.
If this is your story, my advice to you would be, 1, learn your body. If this isn't your first pregnancy, make sure you know how your body functions when you get pregnant. Then I'd also say that be true to your emotions. Don't let anybody dictate to you how it is that you need to mourn. If you want to mourn, mourn. And if you're one that you miscarry and tomorrow you can get up and go. Don't let anybody tell you that you have to sit and cry for 2 years or whatever it is. But be true to your emotions. Do what I didn't do. Get help. I thought that I was fully okay, and it wasn't until a few months ago, actually, which is almost 2 years after the second miscarriage, that I actually had an emotional break. Like I broke down and I just wasn't managing well. I felt like a failure as a person, as a wife, a mother, an employee. I just felt like I was a total mess, and I could not understand what the root of it, because I'm normally very well put together and in tune with my emotions, and I can fix myself. And I realized, no, I need to get help, and I went and got counseling, and it is in that session we found out that the root of it was just undealt with trauma from the loss. So as women, we face a myriad of challenges, health challenges. We face menopause, miscarriage, PCOS, endometriosis, infant loss, you name it. And sometimes it can feel so overwhelming, as if we can't win at this thing called life when we have to deal with this and do regular life. But I'm here to just challenge you and to encourage you to know that together we can win.